What if the most dangerous thing in your day happens right in your own bathroom? You may think your bathroom habits are just routine sitting, wiping, flushing, done. But if you're over 60, what you do or don't do in the bathroom could silently be raising your risk of heart attacks, infections, falls, even death. That's not an exaggeration. New research and clinical observations are revealing a shocking truth. Seemingly small mistakes in the bathroom are costing seniors their health one trip at a time. The hidden dangers behind closed doors. Bathrooms are where most older adults suffer. Silent hemorrhoids and rectal bleeding, sudden spikes in blood pressure while straining, chronic constipation that poisons the gut, slips and falls that lead to permanent disability, UTIs from incorrect wiping or holding in urine too long, anxiety from irregular or painful bowel movements. And yet, nobody talks about it, not your doctor, not your family, and definitely not the commercials promoting laxatives as the solution. But let's be clear, the bathroom is the most dangerous room in the house for seniors, and the most overlooked when it comes to preventive health. All starting from what you do in those 5-10 minutes each day, what you're about to discover will change. How you use the bathroom forever. In this video, you'll uncover the 6 bathroom habits that are silently shortening your life. What to do instead, based on real medical science. Easy changes to your routine that could add years to your life. How to protect your gut, bladder, heart, and bones starting today. Stay with us to the end because habit number 6 is the one that doctors see every week in the ER, and it's the easiest to fix. 6. Common bathroom mistakes, shortening your life. Mistake number 1. Straining on the toilet, the silent stroke trigger. Pushing hard while trying to have a bowel movement. You might hold your breath, brace your stomach, and force it out, especially if you haven't gone in a few days. Most people don't even notice they're doing it. It's become a habit. But after age 50, this habit becomes dangerous fast. Straining triggers a sudden rise in intra-abdominal and blood pressure when you bear down. Especially while holding your breath, called the Valsalva maneuver, your heart rhythm is briefly interrupted, and your blood pressure can spike dangerously high, especially if you already have hypertension or take heart meds. This can cause a sudden drop in blood flow to the brain, disruption in heart rhythm, tiny blood vessels in the brain to rupture, dizziness, fainting, or even stroke. Real consequences. Many cases of stroke and heart attack in seniors happen on the toilet. This is no myth, it's a well-documented ER reality. Straining also weakens the pelvic floor muscles, leading to hemorrhoids, rectal prolapse, incontinence, sexual dysfunction in men and women. What to do instead? Use a footstool or squatty potty. Raising your knees above hip level changes the angle of the rectum, allowing for easier, more natural elimination, no pushing needed. Focus on breathing. Breathe out as you bear down gently. Never hold your breath. This keeps blood pressure more stable and protects your heart. How to apply this today? Place a 6-8-inch footstool near your toilet or use a thick book stack. Practice sitting with your knees up and torso slightly forward. Don't rush, sit, breathe, and let the body do the work. If no urge, get up and try later, never force it. Mistake number 1 may seem small, but it's one of the deadliest. Fix this, and you've already lowered your stroke risk during your next bathroom visit. Mistake number 2, holding it too long. You feel the urge to urinate, but you ignore it. Maybe you're busy, maybe you're out, or maybe you've gotten used to holding it for hours to avoid getting up at night or finding a restroom. It seems harmless, even smart, but especially after age 60, delaying urination regularly can be extremely dangerous. When you hold in urine, your bladder continues to stretch beyond its normal capacity. Over time, this weakens the bladder muscles, reduces sensitivity, and increases your risk of urinary retention. Can't fully empty the bladder, chronic urinary tract infections, UTIs, kidney damage from backed up urine, bladder infections that can lead to sepsis, a life-threatening condition in older adults. Plus, holding in urine frequently increases the chance of bacterial overgrowth, since urine that's trapped becomes a breeding ground for harmful bacteria. Real consequences. Many seniors experience burning pain while urinating, lower back pain from kidney strain, fever and confusion signs of a UTI becoming systemic, nighttime urgency that suddenly becomes incontinence. Worse, some are hospitalized with bladder ruptures or bacterial infections in the bloodstream from simply holding in too long, often without realizing the cause. What to do instead? Train your bladder, not ignore it. Go to the restroom every 2.53 hours, even if the urge feels light. Drink steadily throughout the day, not all at once. Never hold it out of pride, convenience, or habit. Before bed, do a double void pee once, then again 10 minutes later to empty fully. How to apply this today? Set reminders on your phone or watch every 3 hours. Check in with your bladder. Keep your bathroom easy to access, clear paths, night lights. Use a bladder diary for 3 days. Write down how often you go and if you feel full. Avoid caffeine and alcohol before bed. They irritate the bladder and increase urgency. Your bladder is like any other muscle, it weakens when overworked or ignored. Stop holding it in. Listen to your body, protect your kidneys, and prevent life-shortening infections. Mistake number 3. Sitting too long on the toilet. You bring your phone, a newspaper, or just sit and wait for something to happen. It might feel relaxing, but sitting on the toilet longer than necessary, especially with your body weight pressing down, can quietly damage your health in ways most seniors don't realize. Toilets aren't built like chairs. When you sit for too long on a toilet, especially leaning forward with your knees below hip level, you compress your lower blood vessels, which slows circulation in the legs and rectum. This can lead to hemorrhoids, swollen veins that itch, burn, or bleed, varicose veins or deep vein thrombosis, DVT, pelvic floor dysfunction, increasing risk of incontinence, increased pressure on the spine and hips, worsening joint pain, real consequences. Over time, extended toilet sitting leads to bleeding during bowel movements, rectal pain and urgency, leg swelling or numbness, clot formation in the lower limbs, which can become life-threatening if it travels to the lungs, pulmonary embolism. All from simply sitting too long, often without even realizing it. What to do instead? Follow the 5-minute rule. If nothing happens after 5 minutes, get up and try again later. Never force your body, allow natural signals to return. Avoid bringing distractions, phones, books that extend toilet time. Support proper posture. Use a small footstool to lift your knees. Sit slightly forward to relax the pelvic muscles. Breathe deeply, don't push. How to apply this today? Keep the toilet area distraction-free. Leave your phone outside. Set a timer if needed, 5 minutes max. Do light stretching or walking if you feel constipated instead of waiting it out. If regular issues persist, talk to a doctor. Don't normalize 20-minute bathroom sessions. Sitting too long on the toilet is like trapping your body in a slow pressure clamp. Break the habit, restore circulation, and protect your gut and legs. Mistake number 4, wiping the wrong way. After using the toilet, you wipe like you've done for decades. But if you're wiping from back to front, using rough toilet paper, or over-wiping to feel clean, you may be putting yourself at risk for serious infections and skin damage. This habit may seem minor, but for seniors, it can become a gateway to urinary tract infections, UTIs, anal irritation, and even long-term bladder issues. Why it's harmful? The perineal area, the space between your genitals and anus, is very sensitive, especially as skin thins with age. Wiping from back to front can pull harmful bacteria from the rectal area toward the urethra, especially in women, where the urethra is shorter and closer to the anus. Over time, this can lead to recurring UTIs, bladder infections, vaginal irritation or discharge. In men, possible prostatitis infection of the prostate. Harsh wiping can also cause micro tears in the skin, burning, itching, or rashes, worsening hemorrhoids or anal fissures. Real consequences. UTIs in seniors are not just annoying. In many cases, they cause delirium, confusion, even hospitalization. And repeated skin damage can open the door for fungal infections and slow wound healing, especially in diabetics. What to do instead? Always wipe front to back, especially for women. Use soft, unscented toilet paper, no fragrance, no bleach. Dab gently, never scrub or overwipe. For extra care, use fragrance-free wet wipes or a peri bottle with warm water. For those with mobility issues or arthritis, consider a bidet attachment affordable, hygienic, and extremely helpful. Or use a squeeze bottle like postpartum moms use to rinse instead of wiping. How to apply this today? Next time you go, notice your wiping direction be deliberate, not automatic. Check your toilet paper switch to a softer, chemical-free brand. If you've had more than 2 UTIs this year, changing your wiping routine could make all the difference. Install a simple bidet under $40 in under 15 minutes. Wiping the wrong way is one of the most preventable causes of infection in seniors. Fix it today, and you protect your bladder, kidneys, and long-term health. Mistake number 5, ignoring constipation. You haven't gone in a day or 2 or even 3. Your belly feels tight, but you tell yourself it's normal at my age, so you wait, or you take a quick laxative and hope it passes. But when constipation becomes routine, or you ignore the warning signs, it can quietly become a serious health risk that damages your gut, brain, and heart. Why it's harmful. Constipation is not just an inconvenience. It's a symptom of something deeper going wrong in your digestive system. After age 50, several factors make constipation more likely. Slower gut motility, less stomach acid, dehydration, reduced muscle tone in the colon, medications like calcium, opioids, blood pressure drugs, or iron. But the real danger is what happens when stool sits in your colon for too long. It hardens and stretches the colon walls. Toxins and gases reabsorb into your bloodstream. Bloating increases abdominal pressure. Risk of diverticulitis, impaction, and even colon tears. Real consequences. Chronic constipation is linked to brain fog and fatigue from toxin buildup, increased risk of colorectal cancer, heart strain from pushing, ruptured hemorrhoids or anal fissures, loss of appetite and nutritional deficiencies, depression and anxiety due to gut-brain axis disruption. In short, a simple issue becomes a slow internal poisoning process. What to do instead? Instead of ignoring constipation or relying on laxatives, hydrate deeply, 6 to 8 glasses of water daily, especially warm water in the morning. Add soluble fiber, chia seeds, oatmeal, cooked carrots, psyllium husk. Move your body. Even 15 minutes of gentle walking stimulates bowel motion. Use magnesium citrate natural stool softener under doctor supervision. Establish a toilet routine. Try to go at the same time daily, preferably after breakfast. How to apply this today? Start your day with a warm glass of lemon water. Sprinkle 1 tablespoon of chia seeds into oatmeal or yogurt. Go for a short walk after meals. Track your bowel movements, yes, really for 7 days note. How often? How hard? How complete? If you haven't gone in 3+ days, don't wait. Address it naturally or speak to your doctor. Constipation is your gut's cry for help. Don't silence it. Relieving it naturally not only improves your digestion, but can also sharpen your mind, lift your mood, and protect your colon for years to come. Mistake number 6, rushing after you flush. You finish using the toilet, flush, and immediately stand up sometimes too quickly. Maybe you feel lightheaded, maybe your knees are stiff, but you push through it. You're just getting up. Right. But for older adults, standing too fast in the bathroom is one of the most dangerous everyday actions you can take. Why it's harmful. After sitting on the toilet, especially while straining, your blood has pooled in your legs and your blood pressure may have shifted. Standing up too quickly causes orthostatic hypotension, a sudden drop in blood pressure that can make you dizzy, disoriented, weak in the legs, more likely to trip or lose balance. Combined with the slippery floor, dim lighting, and limited space in most bathrooms, this creates the perfect storm for a devastating fall. Real consequences. Falls in the bathroom are a leading cause of injury-related death in seniors. A simple trip can result in hip fractures, which have a 1-year mortality rate as high as 30%, head trauma or internal bleeding, loss of independence, long hospital stays, infections, or even early dementia due to immobility. All from a rushed moment after a routine activity. What to do instead? Pause before standing. Stay seated for 5 to 10 seconds after flushing. Breathe deeply. Make sure you feel steady before rising. Hold a stable surface. Use a grab bar, not a towel rack, to help you stand slowly and safely. Avoid sudden movement. Engage your core. Plant your feet flat. Stand up gently, not with momentum. Light the way. Install motion sensor, night lights in your bathroom for visibility at night. This alone can reduce fall risk dramatically. How to apply this today? Add a non-slip mat and wall-mounted grab bar near your toilet. Practice pause and breathe after every flush. If you feel dizzy upon standing, mention it to your doctor. It could be a sign of blood pressure imbalance or medication side effect. Wear slippers with grip if you get up at night. One rushed movement can undo decades of health. Slow down. Protect yourself. Your balance is your independence. Your bathroom habits may seem small, private, routine, but now you know they're not just about comfort. They're about life or death, mobility or fragility, independence or the hospital bed. By fixing just a few habits, you reduce your risk of falls, UTIs, and heart events. You improve digestion, bladder health, and mental clarity. You protect your dignity, your strength, your years. It starts with being aware, and it continues with daily action, small steps that protect you where no one else sees. So here's your challenge. Pick just one mistake you've been making. Change it today. Feel the difference tomorrow. And if this video helped you, don't keep it to yourself. Share it with someone over 50, your spouse, your parent, your neighbor. Like this video, subscribe for weekly senior health tips, and comment below. Which habit surprised you the most?